Hello, gentlemen. My name is Dr. Emma Schneider, a geriatric physician and male hormone specialist based in Munich, Germany. Over the past 30 years working with men over 60, I've come to realize a troubling truth. Up to 80% of my male patients experience a gradual decline in vitality, fatigue, poor sleep, and reduced desire, and they have no idea why. Most of them simply blame aging, but in reality, age is not the real culprit. There's a silent mistake, incredibly common, that nearly every man makes after 60. And that very mistake silently lowers testosterone, slows blood circulation, and weakens sexual function day by day. This video will help you identify that mistake, and more importantly, show you how just a few small habit changes can help restore your manhood naturally without medication. Let's begin. I began my medical career in a small clinic in southern Germany. I was just in my 30s, full of passion, but still unaware of what men over 60 truly go through. After more than 3 decades of listening to and treating thousands of older men, I realized something. The physical changes after 60 aren't always diseases, but they deeply affect quality of life, self-esteem, and even family relationships. Sadly, many men don't realize their body is sending warning signs. Some have frequent insomnia, a drop in desire, or no longer wake up like they used to. They accept it as part of aging, but the truth is, aging plays a part. The rest comes from silent, repeated mistakes. A study from the European Journal of Endocrinology revealed testosterone drops significantly after age 55, especially in men who sleep poorly, don't exercise, eat irregularly, or hydrate incorrectly. Over 75% of men over 60 haven't had their testosterone checked in the last 5 years. I don't want my patients to just live longer. I want them to live stronger, live confidently, and keep their manhood even past 70. And to do that, you need to identify the silent mistakes that slowly wear you down. In the next part, I'll share the single most common mistake 80% of men over 60 make, and how you can avoid it starting today. Over the years working with older men, I often begin with what seems like a simple question. When was the last time you checked your testosterone level? And almost every time they pause, then say, "I've never had it tested." That response always gives me pause, because testosterone isn't just about intimacy, it's the foundation of a man's strength, memory, sleep quality, and inner confidence. And yet, it's the one thing most men never think to check, until it's too late. Testosterone is the core hormone that defines male vitality. It's produced primarily in the testicles, regulated by a finely tuned system involving the hypothalamus and pituitary gland in the brain. Beyond controlling libido, testosterone plays a central role in building muscle, generating energy, maintaining focus, and stabilizing mood. And most importantly, testosterone is the key factor in achieving and maintaining strong, natural erections. After age 60, a gradual decline in testosterone is natural. But the real danger is that most men never monitor or manage this change. A large-scale study from the European Male Aging Study shows that testosterone typically decreases by 1 to 2% per year after age 40. However, when combined with poor sleep, low physical activity, chronic stress, or irregular eating habits, the rate of decline can double, leading many men in their mid-60s to experience fatigue, low libido, and erectile difficulties without understanding why. The good news? This decline can be slowed, and in some cases improved, through early awareness and healthy lifestyle changes. A 65-year-old man can still maintain strong testosterone levels, as long as he starts making the right choices today. As an endocrinologist, I often remind my patients, the body always sends signals. The question is, are we truly listening? When testosterone declines, the endocrine system doesn't go silent. It sends out early warning signs, but most men overlook them, thinking it's just normal aging. For example, you no longer wake up with a natural morning erection. You feel tired for no clear reason, even with enough rest. Your belly fat increases, even though your diet hasn't changed. You feel less desire for your partner, or notice you've become more irritable, even withdrawn. These aren't just signs of aging, they're your body's quiet cry for help from a hormonal system that's falling out of balance. The good news is, if caught early, you can restore that balance before the damage becomes much harder to reverse. There's a question I keep coming back to. Why do most men never get their testosterone levels checked? The answer is surprisingly simple. Because no one ever told them it matters. Even within the medical community, male hormones are often not treated as a priority because many assume that weakness and fatigue are just part of aging. But I don't believe that. I believe this. A man who understands his body is a man who can stay strong, confident, and independent for years to come. A testosterone test takes just 15 minutes, but the insight it gives you can help you live healthier, more energized, and more confident, not just today, but for the next 15 years. And the best part? You can start today. I often tell my patients, your body always knows how to speak. The real question is, are you listening? Sadly, many important signals, like persistent fatigue, poor sleep, or low desire, are often dismissed as just part of getting older. But in truth, these could be the first warning signs of hormonal imbalance or early metabolic decline, and if we catch them early, there's so much we can do to turn things around. One of the first signs I often ask my patients about is whether they still experience morning erections. This isn't random. It's a natural physiological reflex. According to the American Urological Association, healthy men typically experience 3 to 5 erections each night, mostly during deep sleep. When this pattern disappears or weakens significantly, it may indicate declining testosterone levels or poor pelvic blood circulation with age. It's a simple physical cue that many men overlook, but it can offer real insight into your overall male vitality. If you're sleeping 7-8 hours a night but still feel tired, sluggish, or low in energy, the problem may not be your sleep. It may lie in your endocrine system, especially your adrenal glands and testosterone levels. Testosterone doesn't just affect sexual health, it plays a major role in motivation, memory, and emotional balance. When testosterone drops, men often feel unmotivated, mentally foggy, and lack energy to start the day. Even after a full night's rest, it's an early warning sign that far too many men ignore. One commonly overlooked sign of declining testosterone is having cold hands and feet, especially at night. When testosterone drops, blood circulation slows down, making it harder for warm blood to reach the extremities. More importantly, poor circulation also affects blood flow to the pelvic area, which can quietly impair a man's ability to achieve and maintain an erection, even if his heart and blood pressure appear normal. So don't ignore that constant chill. It could be an early sign of circulatory decline linked to low testosterone. In men over 60, mild prostate enlargement is common. But when it's combined with low testosterone and the habit of drinking water too late in the evening, you're more likely to experience frequent nighttime urination. This disrupts your sleep cycles, preventing the body from entering deep sleep, the very phase when growth hormone and testosterone are naturally produced. It creates a physiological loop: nighttime urination, poor sleep, lower hormones, even more urination. Without early intervention, this vicious cycle can accelerate both hormonal decline and overall male vitality. These signs aren't just getting old, they are signals calling for your attention. In the next part, I'll show you how to naturally restore testosterone, starting with something simple: how and when you drink water. Many believe declining vitality after 60 is inevitable, but the truth is it's the result of 3 silent failures: the liver, muscle mass, and pelvic circulation. Many men assume that poor sexual function after 60 is simply inevitable, but that's not true. It's actually the result of a gradual decline in 3 essential systems: the liver, which processes hormones, the muscles, which store and support testosterone levels, and pelvic blood circulation, which is key for achieving and maintaining erections. When these systems weaken, so does male vitality, but the good news is, this can be improved with timely action. Few people realize this. The liver plays a crucial role in maintaining male hormonal health. It's the liver's job to process and eliminate excess hormones, especially estrogen, the female hormone. When liver function weakens, due to aging, alcohol, or overuse of medications, estrogen starts to build up in the bloodstream, which in turn suppresses testosterone production. What happens next? Men begin to develop belly fat, lose libido, and may even experience subtle signs of feminization, like chest fat accumulation or mood instability. That's why protecting your liver after 60 isn't just about living longer, it's about preserving your masculine vitality every single day. Muscles aren't just for movement. They act as a hormonal reservoir that helps men maintain stable testosterone levels. When you stay active, your muscle tissues send signals that stimulate healthy testosterone production. But after age 60, if you stop moving, you could lose 3 to 5% of your muscle mass each year. The result? Reduced strength, poor physical control, and more importantly, a silent loss of masculine power and vitality. That's why protecting and preserving your muscle mass should be seen as a core part of maintaining your testosterone and your identity as a man. After the age of 60, the tiny blood vessels in the pelvic region, especially those leading to the penis, become more prone to mild atherosclerosis or blockages. When you're sedentary, sit for long hours, or don't hydrate enough, blood struggles to reach where it matters most, your genital area. The result? Erections become harder to achieve, the pelvic area may feel cold, and that once strong morning signal slowly fades away. Microcirculation may be subtle, but improving it can bring noticeable changes in your vitality within just a few weeks. What I've just shared are not isolated issues. Poor pelvic circulation, muscle loss, and weak liver function are tightly linked together. When one system begins to decline, it quietly drags the others down, creating a silent downward spiral that many men never notice until it's too late. But here's the good news. Even after 60, your body still has remarkable potential to recover if you intervene at the right time and in the right way. And it all starts with simple steps: gentle movement, liver support, and better daily habits. I once treated a 70-year-old patient in Germany. He didn't smoke, didn't drink, and followed a healthy diet. Yet he still felt constantly tired, struggled with sleep, and had almost lost his sense of intimacy with his partner. The problem wasn't his age, it was the result of daily habits that seemed harmless, but were quietly draining his hormones and circulation. After age 60, if you don't walk or move daily, your muscle mass declines, leading to a drop in testosterone levels. Sitting too much also causes poor pelvic blood flow, which directly affects erectile function. One study found that walking fewer than 5,000 steps per day increases the risk of sexual decline by 35%. So, daily light movement is one of the simplest yet most powerful ways to preserve male vitality. Many older men believe that drinking plenty of water before bed helps detox the body. But after 60, this habit can backfire. When you consume a large amount of water close to bedtime, you're likely to wake up 2-3 times at night to urinate. This disrupts deep sleep, the very phase where your body produces the most testosterone. The result? Poor sleep, daytime fatigue, and lower testosterone levels. So be sure to stop drinking water at least 2 hours before bedtime to protect both your sleep and your hormones. Having dinner after 8 p.m. may seem harmless, but it significantly disrupts the male hormonal system. Late-night eating forces your liver and pancreas to work overnight, causing insulin imbalance that suppresses testosterone production during sleep. The later you eat, the higher your risk of restless, fragmented sleep, and your body loses the chance to properly recover. That's why I recommend finishing dinner before 7 p.m., so your hormones can rest and repair according to your natural rhythm. I've seen many patients over 60 taking 5 to 6 different medications daily. But no one told them that some of these drugs may harm their sexual health. For example, diuretics, statins, blood pressure meds, or antidepressants, when used long-term, can lower libido and lead to erectile dysfunction. Worse yet, the liver becomes overloaded from metabolizing multiple drugs, reducing its ability to eliminate excess estrogen, which disrupts the male hormonal balance. That's why you should never self-medicate and always consult your doctor if you notice a decline in sexual function. These habits silently erode your masculinity, but with a few small changes, you can reclaim your vitality and confidence. Big improvements don't start with big things, they start with small habits. Here are 3 simple changes that can help your body naturally boost testosterone, safely and sustainably. Every morning, after waking up, I advise my patients to drink a glass of warm water, around 250 ml. This simple habit helps jumpstart circulation and activates the liver, kidneys, and adrenal glands, all of which are key players in hormone production, including testosterone. A report from Harvard Health shows that drinking water at the right time in the morning can boost circulation and overall energy. Start this small habit tomorrow, and your body will thank you for it. One of the simplest ways to boost testosterone is to take a light morning walk. Just 15 to 20 minutes of walking outdoors can stimulate pelvic blood flow, improve oxygen to the brain, and activate the pituitary gland, the hormonal control center of your body. Plus, early sunlight exposure supports the production of vitamin D, a critical factor in maintaining healthy testosterone levels. Remember, you don't need to run or lift weights. Just step outside, stroll through the park, and let your body function as nature intended. Many men underestimate the impact of proper dinner timing on their hormonal health. Eating too late forces the body to digest while you sleep, disrupting the liver's natural rhythm and interfering with overnight hormone production. Instead, aim to have a light dinner with protein and vegetables before 7 p.m. This gives your liver time to rest, allows hormone systems to reset, and by morning, you'll feel more energized, both physically and sexually. These 3 habits may seem small, but they lay the foundation for restoring male strength. Don't wait until it's too late. Start with the simple things you can control today. I know. If you're still watching now, perhaps you're tired of feeling like less of a man over the years. But let me tell you, not to comfort but to reassure. Your body hasn't given up. It's simply waiting for you to listen again. Every small habit is a big decision. After 60, we can't live like we did at 30 or 40. Every glass of water, every step, every hour of sleep affects your testosterone, your circulation, and your manhood. And the best part? Your body will respond the moment you choose to care again. Don't wait until it's too late. Start today. Drink water at the right time, take a morning walk, go to bed an hour earlier, just 7 days, and you'll feel the difference. If you've made any of the mistakes I mentioned, leave a comment below. I read every one, and I'm here to walk alongside you on your journey to healthy aging. If you found this video helpful, click subscribe. I'll be back with more simple, science-backed advice to help you feel stronger, sleep better, and regain your confidence every day.